Talking about kidney disease. Did you know it is the 10th leading cause of death in America? And in states like Illinois, it's even higher. It's the 9th cause. We've got Washington University's Dr. Anuja Java joining me to explain why that is, and also to discuss the Kidney Health for Life campaign that started last fall. Good morning, doctor. Thank you so much for coming in.
Good morning. It's a pleasure to be here today.
Shall we begin with explaining kidney disease? Define it for me, if you would, please.
Definitely. So kidney disease is any condition that damages the kidney such that the kidneys cannot function to maintain healthy living. So kidneys cannot do their job. They cannot get rid of toxins, cannot get rid of excess salt and water. And when that happens, the toxins build up in a patient's blood and it makes them feel sick.
Sometimes it's congenital, meaning they were born that way. Other times it's environmental. What do you experience mostly?
Absolutely. So the most important causes of kidney disease, the two most important causes that affect about 70 to 75% of patients are high blood pressure and diabetes. Mm-hmm. And additionally, there could be other reasons like you mentioned. There could be a genetic cause, there could be autoimmune conditions like lupus, there could be inherited diseases like polycystic kidney disease, infections, kidney stones, things like that.
Why do you find more cases in Illinois?
So Illinois, like you probably mentioned earlier, is that it's the 9th leading cause. Kidney failure is the 9th leading cause of kidney disease is the number 9th in diseases. So
compared to the 10th.
Compared to 10th, but it's just
nationwide,
nationally, right. So in Illinois particularly, there is a heavy population of communities of color, African Americans, Hispanic, and Asian communities. And these communities are more heavily impacted by kidney disease. Partly is because of they're genetically predisposed, but also a major component is social factors, socioeconomic factors. First of all, they are not aware that they're at higher risk. Other things like not having access to resources, not being able to afford a healthy diet or lifestyle factors, simple things like transportation. So those factors affect these communities, and because these communities are heavily present in certain states, they are more heavily impacted.
And oftentimes, if you've got kidney disease, you're not aware of it. It sneaks up on you.
Absolutely. It is called a silent killer for that reason.
Is that right?
Yeah. In the early stages, there are no signs and symptoms. It's only in late stages when you're really end-stage kidney failure is when you really have symptoms. So it sneaks up when you're almost end stage.
So as a doctor, you're left saying, oh my gosh, I wish we had known about this maybe 10 years ago, 20 years ago. That's why you started the Health for Life campaign last fall?
Exactly.
How's that going?
Exactly. That's going really well. So last fall, the National Kidney Foundation of Illinois launched a campaign, the Kidney Health for Life. And the mission was to raise awareness, to educate patients about the seriousness of kidney disease with a special focus on communities of color. And what they're doing is through community engagement projects to faith-based outreach, they're conducting community health talks where they're bringing in experts, doctors to places of worship to talk to groups of patients. And that's going really well.
It's going well.
It's going really well.
Well, we'll continue to watch that. This is Washington University's Dr. Anuja Java joining us. Thank you so much for your time today.
Absolutely.